In this video, I will explain how to remove corneal sutures. You will need 27 or 30 gauge needle. You can pull out the sutures with jeweler's forceps or tying forceps or needle driver. The three main points here are: 1. Bend your needle with bevel up. 2. Needle should be pointed tangential to the eye and never towards the eye. Number 3. Needle axis should be perpendicular to the suture axis. You can start by sliding the needle underneath the suture. Try to move sideways to detach the suture from the corneal surface. Cut the suture with one side of the needle tip, and again, your motion should be directed away from the eye and never towards the eye.